Doing a quick film on injury I sustained a couple days ago. I actually tore my biceps tendon training, and I wanted to do a short film on the pre and post-op phases I'm going to be going through. Just to understand, biceps tendon, obviously connected to your bicep, kind of detached from the proximal radius bone, and it wasn't quite painful when it happened. Did feel some pain after a while, but as long as I keep it in sling, it's not too bad. I have it about 90 degrees. If I pull on extension, it kind of hurts. If I do complete flexion, it's going to hurt. But anyway, the plan is it needs to get fixed between 2 to 3 weeks. So I got myself a great orthopedic surgeon, and we're planning the procedure. Surgical procedures will be done next week. And I kind of wanted to film the phases I'll be going through with regards to the rehab and the nutrition supplements that I'll be taking. Which is what I really want to focus on and kind of be the guinea pig of this project. But amino acids, and now there's some post-op supplements to kind of aid in the healing with regards to this injury I had. Usually you say about 4 to 6 months you'll probably have a good recovery, but I'm going to test the waters a little bit and listen to my doctor, of course, but at the same time I just want to see how my range of motion and my strength continue to build. So I'll be following up with another video after the surgery, and then kind of walking the phases through my rehab. All right, got out of surgery a couple hours ago. Tendon, the biceps tendon repair has been completed. It's a little groggy, on some of the strong pain medication, but I actually wanted to record this because now I'll be starting my peptide treatment. I'm going to start with Thymosin Beta 4, and in addition to BPC-157. Those who don't know what these peptides are, I can explain to them later, but they're basically amino acid chains that assist in the recovery and healing of tendons, ligaments, and bones, basically growth factors. I'll be doing that for maybe 2 weeks, and then switching over to CJC 1295 and Ipamorelin, which is another growth factor that aids in healing. So just want to do a quick film. Came out really not too much pain, still groggy from the anesthesia. Surgery went well. 90-degree sling, and take it easy is what I'm going to be doing basically for the next couple of weeks. But what we're hoping is that with the peptide treatment, we can kind of heal and make the healing process faster. Okay, so this is going to be interesting. I'm trying this out on me. A lot of studies have been done, but it has not been FDA approved, and it has not been approved for post-operative patients. But me, I love medicine. I'm in medicine, and I'm looking forward to see how the recovery and rehabilitation process plays out. So anyway, we'll follow up with another video probably during the week, just to see how the phases continue. All right, post-op day 1, feeling good. This is post-op day 1, status post, biceps tendon repair on my right arm. Honestly, the pain was not as bad. I took a Celebrex yesterday when I came home from the OR. I took a Neurontin, gabapentin at night for nerve pain. Today I just took another Celebrex. I did start my peptides. I am on the BPC-157 and beta thymosin 4 combined. So I'm doing that daily until it's done, and then I'll jump on the CJC 1295 combo. Anyway, really satisfied with my surgery so far. I have a 1:30 appointment with the surgeon, just kind of review, check what's going on. But good range of motion, good cap refill, not cold extremities, the splint is not too tight. A very interesting experience having surgery for the first time. 1 minute they're like, oh, we're gonna give you a little medicine. I got a little Versed. I told them I felt a little dizzy. Next minute it was gone, and then I wake up in post-recovery. So that was quite interesting, not knowing what's going on. But anyway, nonetheless, I think the surgeon did a fantastic job, Bertor. great orthopedic surgeon, friend, colleague of mine, and customer service was excellent at the office, at the Western Outpatient Surgery Center. I got to give them a big shout out to because they were fantastic. Everything was professional, clean, expedited everything for me, and honestly, I have to say I'm very, very satisfied with the surgery. I look forward on the recovery, and basically this is why I'll be filming, just catching up to see how I recover. Obviously this arm's going to stay at a 90-degree angle until I get further instructions to move it. But anyway, post-op day 1, feeling good. What's up, guys? All right, this is Ray. Again, we're post-op week 1. Status post tendon repair surgery. Biceps, here's my incision. Here's a scar. It's about 1.5 inches. It's been subcuticular stitched with some Dermabond, and that's what you see there is kind of the glue. Bring it up close so you can see it. Anyway, I'm doing pretty good overall. Haven't been taking no pain medication, stayed away from the narcotics, absolutely. I am doing my peptides, and if I have a little discomfort, maybe a Celebrex or some ibuprofen during the day. But the splint is off, have some slight ecchymotic bruising, some bruising under the skin. Range of motion still limited, as you can see. Maybe I'm about 100 degrees on flexion, and on extension, maybe about 30 degrees, 35 degrees. Anyway, don't want to overdo it. I want this to heal. Rule of thumb, we always say broken bone usually heals in about anywhere from 6 to 8 weeks. What they've done is that they retracted the tendon down, drilled into the radius, and popped the tendon back in. So basically the bone is going to kind of heal over that tendon. So we did the cortical button fixation approach. So I always think, well, if there's a bone broken, it's going to take about 6 to 8 weeks, and I want that bone to solidify. The great thing about our bodies, it does produce cells called osteoblasts, which helps kind of re-cement that hole and make it strong again. And I want that tendon really tight again. I'm not overdoing it, even though I am back in the gym today. And when I mean back in the gym, legs, a little bit of cardio, machines. You don't have to lift weights and go crazy. It's not about that. It's about really taking care of your body and you want to heal. A little bit of biomag background. I'm a physician assistant. I've been practicing medicine for about 15 years. And I've always found it interest of how the body works, how it heals. And now being on the other side of this, I am a patient. I had surgery, and I've been doing a lot of research on nutrition, supplementation, and peptides. So I decided to kind of really go that route, kind of avoid narcotics totally, and kind of see what amino acids can do, since they're the building blocks of basically of our bodies. You have a protein molecule. People say, oh, you work out, eat protein. Protein will build lean muscle, which it does. However, a protein molecule, if you break them chains down, you're going to have chains of amino acids and specific links. And then that's where peptides come in, because peptides are kind of the broken links of derivatives of growth hormone, and specifically for a link that can build and rehab your tendons, muscles, and bones. So interestingly enough, lately I've been doing a lot of reading on peptides, and I know one of my colleagues, Dr. Sanchez, who helped me get my peptides for the purpose of recovery and bone healing. And again, they are basically, if you take growth hormone, we take a specific links out of those growth hormones that help in aid of recovery, that help in aid of healing. Growth hormone in general, some people use that to grow, but at the same time, it could be problematic if you have cancer, that tumor can grow. The studies they're doing currently right now show no growth of any cancer cells. However, we specifically take out the links that require for recovery and bone healing, ligament healing, and so forth, and it helps. So I have to say, I'm only 7 days out of the surgery. Really not much pain. The good thing with peptides, it does help improve functional recovery of muscle, tendons, and ligaments. It does have some anti-inflammatory properties. At the same time, it accelerates wound repair. And that's why I've been interested to say, hey, I want to try this. The specific peptide I'm using is BPC-157 and Thymosin Beta 4. It also stimulates granulated tissue at collagen 1 in addition to fibrin matrix repair mechanisms. So it has a lot of healing factors. Basically, I've put the growth peptides in me that aid in recovery and healing. So at post-op week 1, feeling good. I'm taking it easy. I'm supposed to start physical therapy next week after 2 weeks. Doctor instructed not to lift anything more than a coffee cup for 2 months, which gives you about 8 weeks. So, and I totally am fine, and I want that to solid before I go back on lifting weights and really going back into, heavy activity. But you're not necessarily supposed to go back to heavy activity at 2 months. By the book, anywhere from 5 to 6 months. However, I'm going to test my body limits about the 4-month mark and see how I feel. I'm hoping to really have this kind of healed within 3 months, and then we'll take it from there. But again, I'm kind of experimenting this on myself, and maybe this may be helpful for people in the future that undergo surgery or have fractures and they kind of want to heal quick and get back on the swing of things again. But anyways, again, splinters off, doing well. No need to be working out this arm. It just has to heal. If I'm out and about, I am wearing my sling, keep it at 90 degrees just to avoid anyone coming up to me, or kind of situational awareness. When I'm home, kind of let it breathe. One of the reasons why I took off the splint, I was actually getting a reaction to the steri strips. My body, you can see a little mark right here, a scab, but I was getting a little blister, so I may be, my skin, might have some type of allergy to it, and I was kind of getting really itchy. But, doctor knows me, I know him, and he knows I'm kind of compliant. And I says, all right, listen, I'm just going to take it easy, keep it in the sling, and we'll take it from there. So we're a week out. Wanting to start therapy probably after 2 weeks, and then I'm basically just going to work on range of motion, passive therapy, nothing, active or nothing with no weight use at all. And I'm totally fine with that. I still can go to the gym 2-3 times a week. I can still do cardio. Now, I recommend if you're doing cardio, nothing that's going to be running or lifting your feet off, closed chain type exercises, which include like the elliptical machine. You just kind of glide. I get my sweat, I get my workout. I'm holding on, fine. I did that today. Came out, also did, after that, worked some legs, machine, leg extensions, leg curls, some modified squats on the machine, squat machine. So I'm just maintaining that level of fitness and not overdoing it. I also want to say resistant band training has been excellent for a little bit of doing upper body as well. I mean, I know I'm not using my right, I am using a little bit of my left, not going too heavy, but want to keep that muscle memory going at the same time. I'm a type of person that I can't sit on my butt, I can't be a couch potato. If I know my body, if I feel I can do it, I'll take it to the limit a little bit and I'll try it out. But it's too early. I don't recommend this. I don't recommend anyone really kind of starting fitness training right away. Really know your body, know what's going on, and definitely consult your physician. My doctor, Alexander Bertor, is a great orthopedic surgeon down here in South Florida, and known him for many years, and I trust him. Want to mention a few things. When you're looking for a good physician, orthopedic surgeon, you could ask around, ask your friends, look at reviews, look what people are talking about, doctors, and commenting simply on Google reviews or on health grades. I'm all about reviews. I'm all about knowing where I go. It's my primary doctor, I have a great one, great orthopedic surgeon, peptide doctor, I have a great doctor, and I look them up. I want to know where they went to school. I want to know what they did. I want to know what people think about them, how they practice, how they do surgery, because this is the first time me having surgery, and I really have to trust somebody who's going to put me down and cut me open, honestly. However, being that said, probably going to do another video in about 2 weeks. So that'll put me out at 3 weeks post-op. I've done a couple before. I'm going to kind of scrunch all these up so you can kind of see the progress of my pre and post-surgical follow-ups. But anyway, we'll continue. Nutrition supplements. I am taking oral amino acids. Basically bought them on Amazon. Branched chain amino acids, extra L-glutamine, anything that I know that can help recover and get me going on the right track regarding to healing. So stay tuned. We'll follow up again in 2 weeks. But I do plan to give more information out on peptides. I am going to become certified as a peptide specialist as well, because I am really fascinated. Very early right now. You're not hearing a lot of doctors don't even know about it. Studies are still starting right now, and they're actually going to be, different type of peptides coming out for other, problems and medical issues and whatnot. But again, I'm in the field, might as well try it on me than anybody else, and if it works, I'll preach about it. All right, thank you. So, rehabbing my biceps tendon repair. We're about over a little 3.5 weeks, doing fantastic. Got good range of motion on extension, flexion. There's a scar, so you can see it's healing well, okay? So I started doing a little bit of rehab of myself. I got the good range of motion, didn't have to go to physical therapy. I just kind of let the sling off a little bit and started working it. Comparing biceps, I mean, this one actually is full, and this one not so full, but it still has some size to it. What I started doing is some rehab at home, very light, and I found out that with bands, it's really helping me recover well. Again, not doing anything extreme, doing very few exercises that requires no extension of my arm. Basically keeping it on maybe a little bit of 90 degrees and flexing a little bit just to build a bicep. Some of the bands that I recommend are Undersun fitness bands. You can get them online on Undersun website. Great bands, different levels. They're also good to stay home and work out. I take them to the beach. I work out in the yard. Right now I'm set up in my garage. That's where I'm kind of hanging out today. So different exercises that I'm doing to rehab my bicep. Usually grab one of the light bands, and what I do is I'll hold it almost at a 45, or actually this would be 90, more of a 90-degree angle. Okay, 45 going diagonal, but at the same time doing some small contractions, nice and light, where I feel a little resistance, and back down, and back down. I'll do about 10, 3 sets. Last one, usually I'll be holding it, just keeping it tense, keeping that resistance on that muscle, relaxing and continuing. So as you see, I'm not doing nothing that's requiring full extension. That's where you really have to be careful. It's not recommended to do any type of training or physical activities after 4 months. Yes, I am pushing the limit. I know myself, I know my body. I'm pretty soon next week we'll be hitting the 4-week only, so that's a month out of the surgery. Again, I don't really recommend this. Any physical therapist will tell you that this is not recommended, but I'm kind of trying new exercises on myself, and I healed pretty good, thank God, and I don't want this to disrupt any tendon or have any issues. But again, I'm finding out that with the bands, I'm not doing anything hard, just slight resistance. I'm doing this again because I have no pain, I feel fine. However, the tendon is still healing onto the bone. So that's, definitely have to remember that it's gonna take some time. I am not doing any pushing exercises. What I am also doing is I'm getting the heavy bands, or you could go with the medium bands. And again, what I'm doing is I'm doing a little resistance. Pull back and release. Again, pull back, squeeze the lats, and release. Again, you notice I'm not doing any heavy extensions or anything that's requiring any weight to pull me down. For instance, like doing a bicep curl with weights. No, highly do not recommend those type of exercises, especially this early on from the rehab and recovery. So slight exercises that I'm doing, pulling back. I'm also okay with deflection exercise, very light, go with light bands. Here I have, this is Undersun medium, a little worn down. Okay, Undersun medium. These are good if I want to do a little bit of tricep exercises. Again, so for rehab purposes, nothing strenuous. Wrap it around,
get it here at my 90 degree. Again, I will little nice and light. 1, 2, 3, 4, 5. And when I get to 10, I usually get a nice squeeze hold and relax. Again, now you notice I am doing almost 180 degree extension here, stopping a little bit, maybe about 170, 165, but I'm not doing it again. It requires bicep. Again, this is tricep. We're using the tricep muscles, which my tricep tendon is fine. Again, I'm just kind of using it all together. And I would get a workout by doing my triceps, get my heavy bands and doing my squeeze. I'll be stepping probably a little further back, but for the video I'm showing you this to you. And then going with the light with my bicep resistance. So I have 3 different type of exercises, maybe 10 to 15 repetitions, 3 sets each, and doing this probably every 2 to 3 days. Definitely incorporating my leg workout. That hasn't changed. My cardio's fine. That hasn't changed. So I'm, ran a mile and a half yesterday. So it doesn't mean that because you had surgery, your upper arm, you can't do anything. No excuses. Continue to eat healthy. Continue to, if you can, you feel like you can do your lower body. Again, do as you can. Don't overexert yourself. If you don't feel comfortable, let's say you're starting to jog and you're like, oh, that kind of hurts. Just stop. Don't worry about it. No rush. You got to know your body. You got to take it easy. Luckily for me, I've been kind of recording every couple weeks my healing process. I am taking my peptides. I don't know, maybe they are actually working. I took the chance to take Peptide BPC-157 and Beta Thymosin 4. My doctor told me, try this, it's going to help you in healing, you'll recover faster, and I have full range of motion. I feel good, not lifting anything with this arm, still taking it easy. My surgeon said no more than a can of Coke. Obviously a little resistance with the bands, nothing drastic. Again, we're about a little over 3.5 weeks out. What I do want to mention is I was looking at some other videos on YouTube, people who have undergone the same type of surgery, and one gentleman had a sling for 6 weeks. I think he said 6 weeks, and after he took it off, he didn't have good range of motion. He had difficulties doing physical therapy, and he was still in a lot of pain. So then, trying this on me, I figured, and with the approval of my orthopedic surgeon, he says, we'll take off the splint in a week, get you on a sling, but you got to take it easy. Kind of recovered good after 2 weeks. I was off the sling, and I was just letting my arm just drop a little bit. But, good range of motion, no pain. The one thing that I'm glad is I wasn't taking any narcotics, 0. Probably took maybe a Celebrex. I was given 3 types of medication, gabapentin, Celebrex, and Percocet. Just left that Percocet on the side. That was in case if I really had pain, breakthrough pain. Had a few pills available, but didn't want to try that. I was really interested in the peptides. I've read a lot of the peptides. I've been doing my research on the peptides, and I figured this is what I wanted to do. So, decided to go ahead with the peptides. I felt good on the arm, feel good overall, wellness, and this might be something new for bone, tendon, joint, and post-surgical recovery. Keep you posted. Thanks, buddy.